Hello everyone. Today we'll discuss why insulin therapy is important to manage diabetes and how starting insulin treatment can be easy and smooth. To help us, we have a diabetes expert here. Hello Dr. Nishitha Reddy. Thank you for joining us today. Doctor, whenever you prescribe insulin to a patient, the common question comes into a patient's mind is why insulin? Why their previous medications are no longer sufficient? And what are the added benefits of starting insulin? Could you please brief on this?
So, the common question is, what are the indications of insulin therapy? So, definitely, as we have been discussing, so in type 1 diabetes is a definite clear-cut indication for the insulin therapy. Here, the insulin is the only drug of choice for the patient. So, the oral hypoglycemic agents won't work at any cost. So type 1 diabetes mellitus, definite indication. So, what about type 2 diabetes mellitus? So, here comes the doubt. So, see, diabetes is a progressive disorder. So, what happens as years progress, your beta cells start destroying. So, that is called beta cell apoptosis. So, thereby the insulin production may decline. It may come like in type 1 diabetes. So, then the patient needs to start insulin. So, only with multiple oral hypoglycemic agents, we may not able to achieve the glycemic control. So, once the patient is not able to achieve their targets with 2 or 3 agents, please don't hesitate to start the insulin therapy when your doctor prescribes. And suppose in de novo diabetes patient, like new onset, today itself the patient was diagnosed with diabetes, but the sugars like 400, so fasting more than 250, high HbA1c like more than 10. So that patient also definitely we need to start insulin. So why? Because we have to achieve the early immediate glycemic control, thereby we can arrest the glucotoxicity and lipotoxicity happening. So that is also the another indication. And see, for few patients, so like major patients undergoing major surgeries or any critical illness patients, so patient in ICU, severe sepsis or any critical ill patients. So definitely we will start insulin for a brief period till the patient recovers, or post surgery, post recovery of the patient, we can happily stop the insulin. So it is a common myth going on, like once insulin starts, the patient has to take it lifelong. So definitely it is a myth. So insulin is not an addictive drug. Please remember, it's not an addiction. Definitely we can stop insulin if the suppose sugar levels, we are able to control sugar levels for your patient, and also like after surgeries or after the patient recover from critical illness, we can happily stop the insulin and start again, continue only with the oral hypoglycemic agents. And the another thing is, suppose any contraindications to oral drugs, like suppose metformin GI intolerance is the gastric intolerance, or any adverse effects are there. So and also a few cases like chronic kidney failure, renal failure or liver failure. So in such cases also better to start insulin. And the pregnancy is another common indication. So definitely we need pregnant mothers. The insulin is the safest one. So because the drugs will, the oral drugs will cross the placental barrier and may affect the fetus. So definitely there also the insulin plays a role.